Good morning, Mr. Worsby Day Honors Biology class. Reporting live here is Lena. So, what has happened to organelles? Let's find out by looking into the rough endoplasmic reticulum. The rough ER is considered rough because of the ribosomes attached to the outside of it. There are about 13 million ribosomes on the rough ER of a liver cell. The rough ER has a series of cisternae attached by bridging. It gives it the appearance of a flattened balloon. It is a network of tubules, vesicles, and sacs that are interconnected. The rough endoplasmic reticulum's main function is to send proteins from ribosomes to the Golgi apparatus or cell membrane in vesicles. For different cells, depending on the needs of the cell, the rough ER may have a little bit of a different function. The rough ER is a cause for hepatic fibrinogen storage disease. This is a type of endoplasmic reticulum storage disease because it fits the criteria of causing the displacement of an abnormal protein from the rough or smooth ER. In this case, the rough ER. Hepatic fibrinogen storage disease is caused by the lack of normal-sized peroxisomes in hepatocytes. Kind of confusing, huh? Basically, it's caused by the excess accumulation of the fibrinogen molecule in the ER. Type 1 of this disease is caused by a mutated fibrinogen molecule called fibrinogen brescia. Type 1 is much more common than type 2 or type 3. Hepatic fibrinogen storage disease is a liver disease. There are many symptoms of liver diseases. Common symptoms include vomiting, sleepiness, nausea, confusion, and abdominal pain. Also, yellow color in skin, called jaundice, fatigue, weakness, and weight loss. There is also the possibility of a coma. A series of blood tests can determine if someone has a liver disease. These blood tests include AST, ALT, and GGT. Also, INR blood clotting tests, tests for alkaline phosphatase, and tests for bilirubin. Most liver diseases are managed and not cured. The first plan is to cut out the parts of the liver affected and save the rest. For end-stage patients, pills can be given by the doctor to manage the amount of protein that goes into the body. If too far along, a liver transplant is necessary. Many people with liver diseases may have a normal lifespan if they don't show any symptoms. It also depends on how long the person has had the liver disease and if it is being treated. People can live for years with liver diseases even with symptoms. If given a liver transplant, the chances of being alive after a year is between 85 and 90%. The chances of being alive after 15 years is in the 58% range. At the end stages of liver diseases, without a liver transplant, patients will be given certain medicines to make death less painful. So, what has happened to organelles? The mutations in them, caused by many things, are causing diseases and death.